terrain is a little different in that usually workers are employed by a large corporate, and the consequence of the abuse is higher profits and returns. However, in the health sector, particularly the public health sector, the arrangement is a bit different because we have a very important third stakeholder, which is actually the patient. The consequence of which is that we have a relationship, the employer, the employee, as well as the patient, who is part of this equation. So if we take the medical profession, for example, many of whom have to swear an Hippocratic oath as part of their commitment to patients. So irrespective of the circumstances under which you're placed, you're not allowed to put the risk of the health of your patients in any jeopardy. And that's a commitment that health professionals take at the point at which they qualify. Nurses have exactly the same pledge. It's called the Florence Nightingale Pledge, and it's been amended over time. But it effectively provides the same obligation that despite my environment, despite my surroundings, I must make sure that I do the best for my patient and never ever put the health of my patient at risk. So, but international studies tell us that across the world, there are challenges in the workplace, particularly between health workers and health professionals and employers, and the consequence of which has been labor action in those environments. Interestingly, most of the labor actions has not been about salaries, it's been more about working conditions. If you look across the board in most of the countries where it's happening. In South Africa, and I think the chairperson has pointed this out very nicely, that there are a number of regulations that govern the way labor can engage with the employer around conditions of employment. And there are a number of mechanisms within the Labor Relations Act that allow employees to be able to engage and achieve the objective that they would think is appropriate and fair for themselves. So it's important for us to appreciate those mechanisms and try to use those mechanisms in order for us to achieve the objectives where the employer is failing to achieve his or her part of the agreement. It's also important for us to appreciate that working in the public health system is very different from working in the private health system in South Africa. The patients that come to the public health system are those who have no other choice very often. They are unable to pay the high fees of the private health system. And so failures to deliver services to these patients mean they actually have access to no treatment at all.